Then nursing diagnosis, we are moving to now nursing diagnosis. We are finished with the assessment. So second step in nursing process is the nursing diagnosis. Nursing diagnosis is a clinical judgment about a patient's problems or life processes. It provides the basis for selecting nursing interventions to achieve positive patient outcomes. So after collecting all the data that we have collected in the assessment, then we need to identify what exactly is wrong with the patient, and that is what is the nursing diagnosis in simple terms. Purpose of nursing diagnosis. The primary purpose of nursing diagnosis is to guide the planning and delivery of nursing care. Then also it helps nurses identify the patient's specific health issues and develop a care plan tailored to address those issues. So we identify the issue or the problem with the patient, then we come up with the solution that is directed towards solving that problem. Components of nursing diagnosis. These include the following. We have problem or diagnostic label. So this describes the patient's health issue. For instance, impaired gas exchange or acute pain. Then we have etiology or related factors. This identifies the underlying causes or contributing factors that lead to the health problem. For example, related to pneumonia. So we can say that impaired gas exchange related is the problem itself. Then the second component is the cause. Then the third component is the signs and symptoms or defining characteristics. So these are the objective and the subjective cues or evidence that support the diagnosis. They help confirm the presence of the health problem. For example, as evidenced by decreased oxygen saturation. So we can say that impaired gas exchange related to pneumonia as evidenced by decreased oxygen saturation. So you have tested the saturation of oxygen in the patient's body and it is low. So you come up with such diagnosis. So those are the three components of nursing diagnosis. Types of nursing diagnosis. We have actual nursing diagnosis. These are based on current health problems that the patient is experiencing. For example, acute pain related to surgical incision. So this actual nursing diagnosis actually is the type of nursing diagnosis that is made when the problem has already occurred. The patient is undergoing it. The patient has been done the surgery and is indeed in pain. Then we have the second type is risky or potential nursing diagnosis, and these are used when a patient is at risk of developing a health problem but has not yet manifested signs or symptoms. For example, risk for falls related to impaired mobility. The patient is not able to move well, maybe because the patient is just from the surgery. So if he tries to move, likely the patient is going to fall. So that's why we say risk for falls. It is not that the patient has fallen, but there's a risk that likely the patient may fall. Then, health promotion nursing diagnosis. This focus on improving the patient's well-being and preventing future conditions. For example, readiness for enhanced nutrition related to dietary education. So this shows that the problem is not there, but we identify this, and it is purpose is to make sure that the patient's health is improved or it becomes better. So health promotion. Then care planning. Kind of care is not only made by the medical personnel, but the patient should also be involved in it to make sure that, because there are some parts that the patient is the one who is going to really act on. Then treatment planning, it involves treatment planning for short and long-term goals. Evidence-based practice guidelines inform the goals. So importance of care plans. Care plans are based on evidence-based practice and consist patient-specific goals for supportive for positive outcomes. So the goals that are involved are actually patient-centered. So enhancing communication and the continuity of care and taking into account overall and the comorbid conditions. There are some conditions that will come in on top of what the patient is suffering from. Those are the ones that we refer to as comorbid conditions. So types of planning, nursing phases of planning, we have the initial, the ongoing, and the discharge planning. So the initial planning involves the plan that you make when the patient is admitted or at admission. Then we have the ongoing, is the continuous planning that you make in the course of the care. Then the discharge is made when the patient is about to be discharged. Implementing nursing is of nursing process involves the following: carrying out nursing interventions from the plan and monitoring direct care, education and referrals and more. So you may continue monitoring, you may direct the care, you may be complicated, then you can refer the patient. Referral is also part of the care that you can give to a patient. Using nursing interventions, classification, taxonomy. So when implementing the nursing care plans, we use the NIC taxonomy. So the NIC taxonomy is a standardized system that is used by nurses and other healthcare professionals to document and communicate the interventions they perform as part of the patient by senior nurses to make sure that the care that is given to a patient, to our patients, is harmonized and it is standardized. It is so we follow a certain criteria to make sure that we give care to the patient to avoid mistakes that may lead to death. So the purpose of NIC is as follows. The primary purpose of NIC is to provide a comprehensive framework for classifying nursing interventions. It helps nurses and healthcare providers identify and document the actions and activities they undertake to support patient health and well-being. So the taxonomy structure, the NIC taxonomy is organized into three hierarchical levels. Level 1 consists of 7 domains, and these include the following: um, psychological and no physiological. We have the basic, physiological, and the complex behavior. Then we have safety, family, health system, and the community. So the second level involves each domain, but it is further classified into different classes. So these classes offer a more specific description of intervention within the domain. Then in the third level, the classes that were got from level 1, then divided in level 2, are broken down into individual nursing interventions, providing detailed descriptions of specific actions that nurses may perform. So this is where now the interventions come in from. So as we continue, so NIC provides standardized level and the definition for nursing interventions, providing consistency and clarity in healthcare documentation. So this enhances communication among healthcare professionals and this supports research and evidence-based practice. NIC interventions are commonly used in electronic health records, like records that where people use computers and many other gadgets and the other healthcare documentation systems. So nurses can select appropriate interventions from the NIC taxonomy when documenting care provided to the patient, and it makes it really, really simpler than if the patient was to come up with the words that she is. The nurse was to come up with the words that she is supposed to write for that specific care being given. So behavior nursing interventions. We are now looking at the different interventions. So these ones focus on modifying patient behavior. Examples of behavior interventions include the following: encouraging stress and relaxation techniques. So encouraging the patient to relax and forget about his or her stress is one of the behavior nursing interventions. Then supporting smoking cessation, telling the patient to stop smoking, then also engaging in physical activities for anxiety reduction. Those are simple and I believe you can easily understand them. Community nursing interventions address community-wide health behavior change, and the examples of these community nursing interventions include the following: first time mothers education program. So you may come up with a nurse may come up with education program for first time mothers, teaching them how to hold their babies, how to bathe them, how to breastfeed, and it involves all first time mothers within that community. Then another intervention can be promoting healthy diet and physical activities, promoting diet that will not cause less harm to the body, and also encouraging people to do physical activities. Then HIV awareness and violence prevention programs. Then family nursing interventions. These influence patient's entire family. And examples of this include family-centered approach to prevent illness spread, supporting breastfeeding, educating family members about patient care. So all this is under the family nursing intervention. So this involves the entire family to make sure that they give support to the specific patient or the client on those areas that we have mentioned. Then health system nursing interventions is ensure safe medical facility for patients and the staff. And examples of health system interventions include infection risk reduction for patients, patient environment safety and comfort, making sure that as the patient has come to the health facility to get medication, the patient should not go back with more complication, but rather should go back when he is healthy. Physiological nursing interventions. This address physical health needs, basic and complex interventions. So we have the basic interventions include feeding, hygiene assistance. Then the complex are the ones that you really need the skills for, and these include the IV line insertion for fluids and many others. Maybe like a catheterization also, because it requires some skills to perform. Safety nursing interventions. These focus on patient safety and injury prevention. And examples of safety interventions include teaching uh, assistance calling methods like The nurse may be far away. What is the patient going to use to inform the nurse um, about her state, or informing the patient, the nurse, that she needs her by her side? So in some hospitals, um, they can use alarms, but in others, they can use maybe phone calls or things like that. So those are some of the ways that can be taught to the patient. Let's continue. So we are still continuing with nursing interventions. So the nursing interventions can be dependent interventions or collaborative interventions. So the dependent interventions are interventions that are ordered by healthcare providers. For instance, uh, uh, administration of oxygen can be ordered by the doctor, or dietary requirements, medications, and diagnostic testing. Then we have collaborative collaborative interventions. These involve input from entire healthcare team, and they may include physical therapy, personal care, hospice care, and spiritual counseling. Often require consultations or referrals to specialists. And the examples include bathing and dressing assistance to a patient. So those are the collaborative. May not specifically be done by the nurse, but it can be done by help from other disciplines like we have.